All right, everyone. Welcome to our Friday edition of our Next Gen Nurses free webinar series. My name is Jennifer Bonner, and I am so excited for you to be joining me today. We're going to talk about all things MedTerm. Now, this is the very first time we have ever done a webinar, a free webinar on MedTerm. So today we're going to talk about how can you start speaking like a clinical pro. And so regardless of how you feel about MedTerm, it's really important that we understand what these words mean, how to break them down, because not only are we going to be using these words, but we're also going to be reading these words. And so it's really important that we understand what it is that we're reading. But when you're looking at NCLEX type questions, sometimes all it takes is just a little bit of time to break down a word to figure out what those clues might have for you. So we're going to jump right in. But before we do that, I want to just go over a few of our housekeeping things. So, few housekeeping things. If you have a question that you need me to answer, please go ahead and pop that into the Q&A. If you're answering one of my questions like I'm about to ask you here in just a minute, I want you to pop that into the chat. So the Q&A, if you have a burning question that you need answered, please go ahead and put that there. I will try to answer as many of those as I can. If I can't get to it, no worries at all. Go ahead. You can email us at nclextutors@archerreview.com. So let's go ahead and practice this. Where are you joining us from? So please go ahead and put that into the chat for me. Or if you're joining me on um, YouTube or Facebook, please go ahead and pop that in the chat. So where are you joining me from? I am in South Dakota, where it's a little bit dreary, a little bit chilly. Joining me from Texas, Arizona. So again, make sure these go in the chat so we don't bog down the Q&A. Alabama. Oh my goodness. I bet it's hot there. Jamaica, Ghana, Toronto, Florida, Maryland, Michigan, Kenya, Arizona, Brazil, Hayes, Maryland, South Carolina. Welcome, welcome. So, regardless of where you are on the planet, we've got somebody from Japan. Welcome. We are so excited to have you here. So, regardless of where you are, we are all headed towards the same goal, or maybe there are some of you that have already reached the goal. So, let's see who we have today. How many of you, let me know in the chat, are still in nursing school? How many of you are still in nursing school? Let me know. Okay, a few of you who are still in nursing school. Awesome. Way to go. Way to go. Okay, how many of you are getting ready to take the NCLEX? I see someone that says May just passed my NCLEX. Congrats. Okay, several of you are getting ready to take the NCLEX. All right. How many of you are getting ready to go into nursing school? How many of you are maybe getting ready to take the T's or maybe just got accepted into nursing school? Awesome. Waiting for your ATT, June 24th. All right. So wherever you are on your nursing journey, we have a space for you because again, this is important. Whether you're getting ready to go into nursing school, you're already a nurse, you're getting ready to take the NCLEX, or maybe you're trying to get into APRN school. We have a spot for you here at Archer Review, and MedTerm is going to be applicable. So before we dive right in with our information, tell me, how do you feel about medical terminology? When I was a nurse or when I was getting ready to go into nursing school, even when I was in nursing school, I'm like, oh man, this seems like a lot. But I started to think back to my elementary school days where we started talking about root words, word sections, so prefixes, suffixes, what's the root word, and all of that was preparing me for this season in life. So I'm seeing I have a couple that are feeling really good about it. I'm having a couple of you that are saying you're really struggling. So wherever you are on this journey, totally fine, we're going to help you. So we're going to start by breaking down words. Now we know that we have a root word, so that is the main word that's in there, but we also have prefixes. Now, somebody let me know, what's a prefix? Where does it go? Is it the beginning of the word? Is it the end of the word? Is it not part of a word at all? What is a prefix? What's a prefix? Okay, it's the beginning of a word. What does it tell us? Is there anything that it tells us? So it can tell us a lot of different things. So let's look at some of the things that we might see as a prefix. So we have something like anti. What does anti mean? What is anti referring to? It's not your mom or dad's sister. Okay. Before. Okay. I'm seeing a lot of befores. Think about like anti. Oh, actually, tell me, how would you see this in a word? Can somebody give me a word that might use the prefix of anti? So this is a position. So many of you are saying antepartum. Okay, antepartum, antecubital. Okay, very good. What about endo? What is endo? Somebody says within, inside. Where might you see the prefix endo used? Endometrium. Okay. Endocarditis. Awesome work. We also have things like hypo and hyper. So what is hyper and what is hypo? Hypo is low. I like it. Hyper is high. Very good. How might you see hyper used? What word can you think of that might use hyper? Hyperkalemia, hypertension, hyperglycemia. You got it. Nice job. Okay, what about sub or supra? What about sub or supra? Above, below. Okay, very good. How might we see that used? Can somebody use sub as a word? Subcutaneous, nice. Substernal, absolutely. What about supra? How would we use the words? How would we use the prefix supra? Supraventricular. Supraventricular, you got it. Nice. Supraclavicular. Okay. Nice job. So when we're looking at these types of prefixes, it's letting us know as at a position. So anti, you might see it like antepartum, before childbirth. Hypo, like hypotension, low blood pressure. What about inter and intra? Those sometimes get confusing. Now, inter is between. So intercostal space, the in between the rib spaces, versus intra would be within. So intravenous. So that is something that is given inside the vein, within the vein. Supra is above. So if I'm talking about, let's say I am in the clinic. So I'm a nurse midwife. I just realized I didn't introduce myself to you. So let me do that right quick. My name is Jennifer Bonner. I am a certified nurse midwife. I've been a nurse for 15 years. So I've used a lot of these words. When I was at the bedside as a nurse midwife, I would use things like suprapubic. So above the pubic area. Trans, that's across. So like a baby could be transverse, okay? Across the vertex, across the abdomen. Transplant, something that's being transferred across from someone to another person. Okay, so we've gone through the basics. Let's see how we might use these in a question. So a nurse is reviewing a client's medical record and sees the term tachycardia. Which of the following best defines the prefix tachy? Is that slow, irregular, rapid, or normal? Let me know. You can let me know in the chat. If you're joining us on Facebook or YouTube, please go ahead. Let us know there in the... Many of you are getting it. Nice work. Okay, what do you think? Slow, irregular, rapid, or normal? Nice work. So when we look at the word tachycardia, what's the prefix there? What is our prefix in the word tachycardia? Tachy, you got it. Tachycardia. So in tachy, this is a prefix that means rapid or fast. So tachycardia is a rapid heartbeat. Now, irregular, this would be, irregular is not tachycardia. And then rapid, well, slow would be what? Slow would be bradycardia. D, a normal would be normo. So our answer here is letter C. So our answer here is letter C. Nice job. Many of you got that one. Excellent work. Excellent work. Let's look at another one here. So a client is diagnosed with hypoglycemia based on the prefix, which of the following best describes the client's condition. Okay, what is our prefix here? What are we dealing with? What's our prefix that we're looking at here? Hypoglycemia. So is that high blood glucose, normal, low, or absent? Many of you are getting this. Nice work. So hypo is low. You got it. So low blood glucose. Nice work. Yes, absolutely. So if you said letter C, you are absolutely correct. Nice job. Let's look at one more. Whoops. The provider documents that the client is experiencing dyspnea. What does the prefix dys most likely indicate? Is it painful or difficult? Fast, shallow, or in are doing an amazing job. I'm incredibly impressed by your not disagree. I disagree here. All right. So dis is a prefix that means bad, difficult, painful. So we know that fast, what would be the prefix that goes with fast? Fast would be tacky. You got it. Nice. What would be the prefix that goes with shallow? We just know that it doesn't go with this. Nice. What about involuntary? That does not go with this. So our answer here is what? Our answer here is letter A. Nice work. Okay, so let me tell you a little bit about some of the amazing things we have going on here at Archer Review. Next week, starting on June 16th through the 20th, from 10:30 a.m. to 12:30 p.m. Central Time, we have the amazing Lauren Korth bringing an amazing pharmacology crash course. Y'all, if you struggle with pharmacology like I did when I was in nursing school, this is the place for you. She's going to break things down in a manageable way where you're going to be able to follow along and come away with some amazing renewed knowledge in the area of pharmacology. So if you are interested, it's $75 and it meets each of those 5 days from those times available. You can scan that QR code. Go ahead and take your phone, scan that QR code right there. Go ahead and get yourself signed up. You won't want to miss it. Go ahead, check out what the hype is all about. The pharmacology crash course is absolutely amazing. Okay, so we know that prefix comes before. So what's the ending of the word? So we have the prefix, the root word, and then we have the what? Yes, it's $75 for the total 5 days. You got it. It also comes away with 9 hours of contact. So 9 contact hours you will be awarded if you're attending. Suffixes, you got it. Nice work. So our suffixes are going to be the end of the word. So we're going to look at some of these suffixes that talk about procedures. So aphoresis. What do you think aphoresis means? Let me know your guess in the chat. Aphoresis. Many of you are having some great answers. Okay, no worries. Okay, what about ectomy? Okay, to remove. Scopy. Nice. What about stomy? Can anybody use stomy in a medical term? Stomy. Ostomy. Nice work. Yes, you got it. Colostomy. Yes. Very good. So if your answers looked anything like this, you are absolutely correct. So apheresis. So that's removal of. So like plasmapheresis. Okay, we're removing, we're treating, we're returning it back to the body. And ectomy. So think about like splenectomy. Okay, we're taking the spleen out. We are removing something, okay, like an appendectomy. Scopy. So this is we're studying or we're examining. So endoscopy, I lovingly refer to that as the butts and guts of the hospital. This is where we're taking a look inside. So we might do an EGD. That's considered an endoscopy. We're taking a look inside the body in the upper portion of the body. Or you can have a colonoscopy. So that's where we are examining the colon, the lower portion of the body. And then we have a stomy. This is a surgical opening. Many of you, oh, ileostomy. Absolutely. Yes. Tracheostomy. We're making a surgical incision in if it's colostomy, where am I putting that surgical incision? In the colon. Nice work. It can also tell us things like anatomy. So these might be things like emia. What is emia? Can you remember? Now, a lot of times, if I can't remember, I might think back to words that I know to see if I can figure it out. Like anemia. Very good. So there are great ways to break down these words to figure out sometimes what is the question asking me? What is it saying? Can I break down that word to figure out what it means? Uremia. Okay, very good. What about urea? What does that mean? Proteinuria. That's protein in the urine. Hematuria. That would be blood in the urine. So what do you think urea means? Urine, you got it. What about cyte? Erythrocyte, blastocyte. Okay. Can anyone come up with a lymphocyte? Very nice. What about amnios? What is amnios? Fluid, okay. Hydramnios, very good. We have water. Amniocentesis, okay. We just made amnio a prefix, huh? Oligohydramnios, very nice. So emia is that abnormal blood condition, like anemia. Urea, again, just like we said, urine. Yep, hematuria. Cyte. Now this is a cell. Many of you got that one. Now, what about thorax? Now, that's the chest cavity. Now, that one was a little bit of a stump for some of you. That's our chest cavity. So, if we have a hemothorax, we have blood in the chest cavity. Okay, let's see how we can do with some questions on these suffixes. So, a nurse is reviewing a client's chart and notes the term gastrectomy. Now, what does the suffix ectomy mean? Is that inflammation, surgical removal, enlargement, or visual examination? What do you think? Nice. I'm seeing some great answers here. So, ectomy. Excuse me. So, splenectomy means what? It means surgical removal. Nice job. So, that's that surgical removal or surgical excision. So, if we have a gastrectomy, we are surgically removing the stomach. Nice job. What does itis mean? Inflammation. So, inflammation would be itis. What about enlargement? What about enlargement? What? Yes, megaly, you got it. And what about scopy? That's examination. Nice work. Very good. All right, the term arthritis appears in a client's record, and based on this suffix, what does itis mean? Is it tumor? Is it infection, swelling, or inflammation? So, arthritis. Bonus points if you can tell me what arthritis means. You got it, Crystal. Nice work. Yes. Joint inflammation. Very good. All right. So our correct answer here is letter D. Nice work. Okay. What does, let's see. Letter A was tumor. What suffix goes with tumor? Hemangioma. You got it. What about infection? Itis. Nice work. And what about swelling? Swelling is a sign of inflammation, but it's not the direct meaning of itis. Nice work. Okay, let's look at our final multiple choice question. A nurse explains to a student that cyanosis is present in a client's fingertips. What does the suffix osis indicate? Death of tissue, abnormal condition, healing process, or lack of oxygen? Osis. Okay, so let's figure this out. What would be the suffix that goes with death of tissue? Necrosis, you got it. What about abnormal condition? So osis is an abnormal condition. What about healing process? That doesn't go with osis, does it? And then we have cyanosis. Now, this is the result from hypoxia. So that suffix does not refer to the condition, so it's not the cause. So our answer here is letter B. Nice work. Way to go. Okay, so if you're saying, Jennifer, I am loving this way of learning, how can I start studying for my NCLEX? Well, I have the perfect thing for you. It's our SurePass combo. Now, this is my number one recommended package to first-time test takers or really anyone is our SurePass combo. We have one for the RN and one for the PN. It comes with everything you're going to need to be successful. With our on-demand videos that break concepts down in an easy way, you can slow them down if you need to as you're taking notes. It comes with our Q bank for each section. So if it's your RN, it comes with your RN Q bank. PNs comes with PNQ Bank, so your NCLEX style questions, and also our 3-day live review. This is my very favorite 3 days. It's very busy 3 days of the month, but is absolutely action-packed, breaking down those high-yield questions that you're most likely to see on your NCLEX. So if you're interested, please go ahead. If you're RN, scan that QR code there on your left. PN, scan it there on your right, and I can't wait to see you at our next 3-day live review. Okay, let's finish up with a few more questions. Let's see, can you figure out what does pancreaticoduodenectomy mean? That's kind of how I break these down. So pancreaticoduodenectomy mean. So if you can section these off. So how would we section this off? Now, if I was taking this question and trying to figure out what this means, I would start with pancreato, duodeno, and then ectomy. So this is a surgical procedure involving the removal of the pancreas and the duodenum. So a lot of times you'll hear this called the Whipple. Okay? Nice work. What about the word electroencephalogram? Electroencephalogram. So I would go electroencephalogram. So someone is saying, I already had the SurePass combo and want to extend. Do I get access to follow more live reviews? So you will not be able to attend the 3-day live review again unless you would like to. You can do a $50 upgrade if you'd like to attend another 3-day live review, but you would still have access to everything else. Great question. Okay. So electricity, and cephalo is brain, and a gram is a recording, image, or tracing. So an electroencephalogram is a test that measures and records that electrical activity of the brain. So a lot of times we use this to diagnose epilepsy, sleep disorders, even brain activity after a trauma or anesthesia. Nice work. Way to go. Okay, our very last one. Pseudo hypoparathyroidism. No, this is not a typo. Pseudo hypoparathyroidism. Okay, so I would break this down here. Pseudo hypo parathyroidism. This one's tricky. Someone says fake hypoparathyroidism. Okay. So pseudo is false. We repeat it again. So this is used redundantly here for a very specific condition. We'll talk about that here in a minute. Hypo is below normal or deficient. Para is beside. In this case, it's the parathyroid gland. So near the parathyroid glands. Thyroid is the thyroid gland, and ism is a condition or state. So this is when we have the repeated pseudo here, it's actually denoting that phenotypic appearance without that biochemical abnormality. So pseudo hypoparathyroidism is a rare inherited disorder that mimics the physical features of pseudo hypoparathyroidism, but it doesn't have that abnormal calcium and phosphate levels. Okay, that one was a little tricky. Now I have a quick QR code here for you. If you are looking for a discount code, you have come to the right place. Just for attending our free webinar today, you can use the code I love Archer to get a 10% off of our products. So please tell your friends, use these if you have attended our webinar. And remember, we are more than just test prep. We are here for you across the lifespan of the nursing process through every step of the way. If you're getting ready to go into nursing school, maybe you just got your acceptance letter, we are here for you. If you're in the thick of it, you're in nursing school, getting ready to take your NCLEX, we are here for you. If you are becoming an APRN, again, we're here for you. So wherever you are, scan that QR code that appeals to your specific situation, and we are delighted to share with you what we have. So thank you guys so much for joining us. I can't wait to see you back here on Monday for our next Gen Nurses free webinar series. Hope you have a fabulous weekend, and thanks for joining me. Take care, guys.